How many surfaces of your teeth do you clean? 1, 2, 3. Bad breath can be caused mainly due to oral health issues, due to decay or inflammation or some type of infection that we have there. Everything is related. We don't treat just one thing. We don't treat the body separately. We need to keep everything. We need to keep your whole body in mind when we're looking after you. We want to see more good bacteria than bad bacteria in your mouth. What's the way of doing that? This is the one thing that I want you to take away to minimize the chances of bad breath. I'm Dr.Maria Florou, and this is Mind Your Mouth. I'll be sharing with you the truth about oral health that most people completely overlook. If you're ready to go beyond the basics, challenge the myths, and truly transform your well-being, let's get started. Do you have bleeding gums? This episode is for you. On this episode, we're going to talk about bleeding gums, bad breath, and sensitive teeth. If you know anyone who needs this advice, please share this with them. So let's get started. So we're going to start with bleeding gums. Why do our gums bleed sometimes? Bleeding gums show us, and that's your body talking that there's been some inflammation happening there. What's happening there is that we have some bad bacteria, some bacteria that we call them pathogenic, so they're not good for our body and they're lurking in your mouth, creating some inflammation. We nowadays see, and something that we can get a sample from your mouth and look on a microscope and see which types of bacteria we have in the mouth, and then we can do further studies from there. But what's really important, we want to see more good bacteria than bad bacteria in your mouth. What's the way of doing that? That your microbiome in your body, starting from your mouth, is actually the way that we want to see it. We've discussed this on previous episodes, but I'm going to go through this once again here with you. We need to look in what you put in your mouth and in your body, but also flossing and brushing is really important. I'm sure you heard this advice before. Yes, it is really important. Let me ask you one thing. How many surfaces of your teeth do you clean? 1, 2, 3. How many surfaces do you clean? Before I give you the answer, I want you to think about it. Type here on the comments, how many surfaces do you clean? And it's fine if you get it wrong, because not everyone knows this answer. We should be cleaning 5 surfaces of our teeth. Imagine that our teeth are like this. We want to clean here, here, there, and the sides. So we're actually cleaning 5 different surfaces, not just 1, not 2, not 3, 5. So how do we do that? Yes, we need to disturb the plaque that's sitting there by brushing and flossing or using a water flosser. As I mentioned before in the other episodes, I'm a big fan of the water flosser. So if you don't know what that is, put on the comments. We can make a video showing you that, or maybe talking more about it. But what we really want to see here is that you understand that all surfaces need to be cleaned. If we don't do that, we have more plaque building up, which means more bacteria and more bleeding gums. A point that's very important when we come to this conversation. What is bleeding gums? It means that we have inflammation plus infection. When we're dealing with bacteria, we actually have infection there, and that infection is going to other parts of your body. We're seeing that leaking through your bloodstream, going to your digestive tract, going to your respiratory tract. We don't want to see these problems. In fact, we see the research showing that 57 types of disease have been correlated to bleeding gums and the type of bacteria that's sitting on your gums there. So we definitely can prevent that in a very easy way. The other topic that comes closely related with bleeding gums is bad breath. However, bad breath can be caused mainly due to oral health issues, mainly due to decay or inflammation or some type of infection that we have there, but it can also be caused by other factors. And it's really important to check with your dentist and check with your doctor or your health allied professional to make sure that you look after yourself as a whole. We need to clear out things and make sure that your body's talking to you, and I want to make sure that you're listening to it. One other important factor with bad breath is the fact that depending on how you breathe, if you breathe through your mouth, if you breathe through your nose, that is very different. We see more mouth breathing correlated with bad breath. And why is that? Because we don't have the saliva flushing everything out. We see more dry mouth with mouth breathing, and that's when we see more tendency of having bad breath. The other key part here that I want to, if you want to take away one thing from this video, this is the one thing that I want you to take away. You need to clean your tongue. So tongue scraping or brushing your tongue is really important to minimize the chances of bad breath, minimize the number of bad bacteria. And sometimes we can either see candida and some fungal infections, especially by signs that we see on the tongue. So make sure you keep your tongue clean. Real quick, your mouth is the gateway to your overall health, and at Casuarina Dental, our focus is on you. If you're ready for a holistic approach to dental care, book your appointment now via the link in the show notes. Now, back to the episode. One other topic that it's widely discussed, and I want to bring this to this conversation with you, is sensitive teeth. Why do we get sensitive teeth? There are lots of reasons for that. I'm going to stick to the most common ones on this video, one of them being brushing too hard. So if you're using a hard toothbrush and you're not brushing gently, or even with your soft toothbrush, we want to make sure that everything happens in a very gentle way around your teeth and gums. To remove plaque, we don't need to scrub, we don't need to use any hard bristles, medium bristles there. We want to use the soft or extra soft bristles. So if you rub too much, if you scrub too much on your teeth, you're going to remove the first layers of enamel there. And what we're going to have left there, it's called dentine or cementum. It doesn't matter. What I wanted to take away from this is that they are more porous areas. And any stimuli, any cold sensation, hot, any sweet that touch those areas travel quite quickly to your nerve. So I want you to picture in your mind that your tooth is a little organ with the nerves right in the middle. So if we have any trauma coming from the sides, it's going to reach the nerve. The body is really wise and it knows how to protect itself. It knows how to remineralize those areas. But if we keep that aggression twice a day by brushing with a hard toothbrush, we're definitely going to see some problems happening there. The other main reason for sensitive teeth is acidity. The acidity could be coming from something that you ate or something that you drink on a daily basis, or even reflux. If we have a lot of reflux happening for whichever reason, if you have GI tract problem or if you're going through pregnancy, any other reasons that would cause reflux, that's a very important thing to look into and make sure that you create an alkaline environment for your mouth. Otherwise, that acidity is going to impact your teeth, and we are going to see more sensitive teeth and even more bad breath and more gum disease. One thing that is really important, and we've created this channel for you to understand that everything is related. We don't treat just one thing. We don't treat the body separately. We need to keep everything. We need to keep your whole body in mind when we're looking after you. And yes, sometimes we need to bring other professionals to the conversation, and we need to look into discussing and treating things with the other experts, and that's crucial for your overall health. So remember, it is very important to minimize the bad bacteria in your mouth and body. The third point about teeth sensitivity is the type of bacteria that we see in the mouth. We see bacteria that like more acidic environments, and they grow better when there is acidity there, and that's when we have thick plaque, and that also contributes to sensitivity. Thank you for staying with us in this episode. I hope we could bring some value to you on how to look after yourself better. If you've enjoyed this, please make a comment and send this to the people that you love so they can look after themselves better too. We'll see you on the next one. Thank you for tuning into Mind Your Mouth. These episodes have been created for you. If you found this conversation helpful, the best way to support the show is by leaving a 5-star review on Apple Podcasts and Spotify. And don't forget to subscribe on YouTube so you never miss an episode. For more tips on holistic dental health, follow me on social media at Casuarina Dental. In the meantime, take care of your smile, take care of your health, and I'll see you in the next episode.